Welcome back, everybody. The community is invited to the brand relaunch for the free medical clinic. They have a newly renovated facility and so much more. Joining me today with more is Karen Pumphrey, Chris Johnson, and Ty Graham. Thank you guys for being here.
Thanks for having us.
Absolutely. Karen, I'm going to start with you. Talk to me about the free med clinic. What is it? What services does the free medical clinic offer?
So the free medical clinic provides medical care and medication access to the uninsured adults specifically. We serve folks that are at the 250% federal poverty level, so about $39,000 a year, that have no health insurance, no Medicaid, no Medicare, and who can't afford medical care. They can't afford to go to doctor's care. They can't afford an ER bill. So they come see us. We have primary care, we have specialty care, we have access to medications, patient education. We connect them with other resources. So if they have issues with food, try to connect them with Harvest Hope and other places that can assist them with the resources that they need.
Wow. And who's eligible for this?
So any uninsured adult 18 and over that meets our financial qualifications. All of that is on our website. But if you're a single household of one, we have to base it on household income. $39,000 or less, we can help serve you.
Wow. Yes. Talk to me a little bit about the impact of the clinic here in the community.
The clinic just celebrated its 40th birthday last year, so we have said we're Columbia's best kept secret. We don't want to be a secret anymore, though.
Good.
Because we're here to serve. We estimate in our lifetime that we have served over 65,000 patients, provided over 100 million, in medications. On average, last year we served just over 1,500 patients, which was a 67% increase over the prior year. Wow. And with tough economic times, we see more folks coming in the door, but that's what we're here to do. We're here to serve.
Yeah, absolutely. Ty and Chris, I'm going to hand it over to you guys now. Why did LC25 choose to work with the free medical clinic?
Leadership Columbia, our class of 2025. So when we first met earlier this year, we were presented with a group of nonprofits, and then we had to choose amongst our class. And I was among one of the original teams that chose the free medical clinic. For me personally, I'm part owner of a health insurance agency. I see it all the time. There are people who we're there to help and serve, just like the free medical clinic is. But unfortunately, there are people who just don't qualify. So with the Affordable Care Act, which is health insurance for people under the age of 65, there are also income guidelines. And if you don't meet certain thresholds, you can get insurance, but you would have to pay full price. You don't qualify for the tax credits or the discounts, which unfortunately in a state like South Carolina, with a lot of lower income people, means that they can't afford it. They go without health insurance. They have no health care access. And I've had people in my office crying. I mean, I remember a single mom in Lexington and taking care of two kids, and she came in, her kids had Medicaid. She said, I need health insurance to take care of me. What if something happens to me and I get sick and there's no one to take care of my kids? And I had to look her in the eye and tell her, you don't qualify for financial assistance, and she left crying. Free medical clinic is a resource, someone that's there for her and for the community to be able to provide those vital services for some of the most underserved in our community.
Absolutely. And I think it's important to know these are real people with real stories. We see the numbers, we see the statistics, we know there's a high, poverty rate here in Columbia. But to hear those stories and actually have conversations and see it face to face, it makes it even more valuable and important that we know about these things. Ty, talk to me a little bit about you guys' project with the clinic. What have you guys been doing?
Yeah, so we have been behind the scenes working a lot, and me personally, I've been on the marketing and outreach team. We've rebranded the logo, which we're really excited about that. Also reaching out to the community to help get, pavement, get painting. I mean, it's been absolutely an amazing experience. And so we're excited about May 5th,
Tell me about May 5th. I need all the details. We've got the brand relaunch coming up. What is that going to entail?
Yeah, so we have a program all set up. It's a relaunch, rebranding. We also have entertainment. We got music. We got food. We got also leaders from the community that will be coming in also to. We'll get a chance to hear from them as well.
Amazing, amazing. And what are you guys' hopes for the collaboration? What are your real goals looking forward?
Yeah, so thank you for asking. So, at the end of the day, it's to increase visibility. She said that, they used to say that they're Columbia's best kept secret. Our goal is to make sure that everyone knows who they are, where they are, what they offer. They're on Hardin Street. Many people, lifelong residents of Columbia, had no idea where they were located. We're helping get a new sign with Colite, with the new branding with some friends with TC Square, you know, and not only the logo, a full organizational marketing rebrand, landscaping, renovating their lobby. And so the goal is to increase, well, first off, make it, you know, more comfortable for their existing patients. And they've already been, you know, telling Karen and others there, you know, how more warm and inviting it is, but also to increase, you know, hopefully future patients, you know, that they're aware of what's available, that the resources that are available to them. And also, hopefully, we can, in the process, increase donors as well that want to give to this organization that's giving back so much.
Absolutely. And I think those types of things are things that probably for you guys gets put on the back burner. You know, when you get those donations, you get those financial help from the community, you want to pour that right back into the work that you're doing.
Absolutely. We pour every cent back into patient care and clinic operations.
Yeah. So how has it been for you guys? Obviously incredible, but you know, to work with them and have them kind of pick up those things that you guys don't really have the time and money to deal with on a day-to-day.
Absolutely. We started our renovation to our facility back in 2022, and it was kind of piecemeal together because it's what we could afford at the time. Them coming in and helping with outside and landscaping and painting the lobby, and especially the marketing piece. I mean, all of that's so expensive, and we can just put it back into our patients and making sure we're here to serve.
Absolutely.
So it's been amazing. As Chris mentioned, patients have said it's so bright in here, it's so comfortable. And that's one thing we've always prided ourselves on, is we provide such an extraordinary amount of care to these patients that's compassionate, and that they can come to the doctors and not be rushed along. They said, y'all actually listen to us and y'all care about us. And we can now match that with the environment.
Yeah, that's amazing. My last question for you is, if people are in the community, they want to help, they want to give back, how can they donate, how can they volunteer, how can they get involved?
Absolutely. So donations, you can donate online through our website, which is freemedclinic.org. We take volunteers in all shapes and forms. We'll take a doctor that wants to come in once a month, or a nurse that wants to come in once a week. Any way you want to volunteer, we can accommodate that. Just reach out to us.
That is amazing. Well, thank you guys for all of the work you're doing, and thank you for everything you've done. All right, guys, we're going to have this information up on your screen, and we're also going to have this all on our website. The Free Medical Clinic brand relaunch is coming up Monday, May 5th from 3 to 5. Again, all of this information will be up on our website. We'll be right back.